This video has the potential to save your horse's life, or better yet, please share this with your friends or colleagues, anybody you work with that works around horses, because the information contained within does have the potential to save their horse's life. And that's the topic of why do so many horses still die from colic? In fact, 1 in 10 horses every year suffer this horrible, painful ailment we call colic. And it actually, in fact, colic is the number one killer for horses under the age of 20. So, in this episode, we're going to explain how this information can be used and how it has helped save horses' lives. In my career, have spoken to many people that knowing about colic and the signs of colic and how to alter their management strategies have gone on to help save their horses or prevent colic. And just to start all this off, if you can imagine, this happened to me quite a while ago when I was a graduate student, but a warm summer day in Texas in the morning. It is warm, it is hot, but I went into the barn to grab a nylon halter, and I had a mare that I had to ultrasound that day to see where she was along her pregnancy. And in my boots and my jeans and walking down the long lane, looking to the left, the pasture of mares and newborn foals, and then off to the right were the mares and the little bit older foals that might have been, 6 to 8 weeks old, and going to our early pregnant mares pasture. And as I walked in there, the pasture had been a little bit overgrown, so the grass wasn't quite, knee high, but just under my knees. And I didn't see my mare, and I didn't know where she was. And I was one of the first ones at the barn that morning. And then walking around the pasture, I saw literally what looked like a crop circle. And I walked, and in the middle was my mare in distress, in intense pain. She had been suffering, I don't know how many hours, with a bout of colic, and it was so painful that she's been rolling and pawing all night that she created a perfect circle within the tall grass. So immediately, thankfully, had cell phones back in the day, even when I was in graduate school, and called the barn manager, who called our veterinarian immediately. And thankfully, I was on the Texas A&M campus where the vet school was across the way, and the veterinarian was able to get there quickly to start treatment. And I'm going to talk in this video about how to properly respond when you come across a situation like that. Not only your safety, but what's best for the horse. But it's something that if you're working with horses, you're going to run into this. Like I started off with, the higher estimates are 1 in 10 horses every year suffer some sort of colic. Now, does that mean 1 in 10 horses die every year from colic? Absolutely not. It's a little bit less. 1 to 2 out of 100 might die from colic every year, but still, it's such an impactful disease ailment that horses have, that's why this is so important. So that's why I get so passionate about it. And just to close the loop on that mare, the vet was able to come. I remember we got her up, we walked her down to the barn. She was just sweaty, all the signs, severe colic, in a lot of pain. The veterinarian came. We did pass a nasogastric tube, which goes through the nasal cavity into the stomach of the mare, pumped her full of oil. The veterinarian treated her with medication, gave her pain relief, and thankfully within a few days it resolved and she was fine and back to go to work normally. But it's such it's a frustrating thing that we have to deal with as horses, as horse owners and lovers, because it is something that you just don't like to see them suffer. You don't like to see a horse in pain, and colic is one of those that you're like, wow, that horse is really suffering. Now, Just to kick it all off again, what is colic? Because that is a very broad term. Now, it means different things to different people. In general, it just means it's abdominal pain. It's a digestive disturbance that the horse and other species like us, we can experience colic, baby colic. Some of you may have had children that have suffered colic. Uh, Other animals do suffer colic. The wild horses, not so much, but again, we'll talk about the reasons why horses get colic. But it's just this general term to say that the horse has a stomach ache. Now, it doesn't necessarily mean the stomach, it's digestive tract, because you have the stomach, small intestine, and then the hind gut of the horse with the colon, the large colon, small colon, and obviously the cecum that they do the fermentation in. So it's just the digestive tract is there's an ailment and it is causing the horse a lot of pain. And there are different types of colic, which we're going to talk about here in a minute, which gives you an idea of um, what you may be facing as a horse owner, what types of colic and how they get it. Now, at the beginning, I said this information can help you save your horse's life. And just to give you another story, many years ago, I was very motivated to obviously this passion I have spread the knowledge about horses and how to care for them. And when I was at the University of Florida, I took it upon myself to create a massive open online course. And at the time, this company called Coursera was starting to go around to major universities in the United States. University of Florida was one of those universities and said, would you be interested in developing free online courses, college level courses for the masses for free? And so I took it upon myself. We'd already offered a music one that had like, I think 80,000 enrollment. It was something fantastic. And I said, wow, if I could reach that many people in a college level course, sign me up. So I applied and my course was accepted and I created what we called the horse course. Now, after I created it, I don't have anything to do with it anymore. I'm working for Mad Barn. But when I was there and after I created that course, we offered a couple live offerings. And I think I had like 40,000 plus signups for the first iteration. It was something really great. But in that course, I developed, there was obviously a topic of colic because it is such an important piece of equine management. And when I was creating that course, I remember the people I was working at UF, I said, I can guarantee you I'm going to save a horse's life by doing this. By getting this information out, I should save at least one horse's life. And if I do, I accomplished something and I did my job and I would be very happy. Well, a few months later, I did get an email one day and I still have the email in a box. And it said, Dear Dr. Mortensen, I just want to thank you. And I could still remember reading this email to this day. The thousands of emails I read in my career there at UF, this one always sticks out. And it said, thank you for your course. It helped save my horse's life. And it was a horse owner. She was actually in Miami, just a few hours south of me. And she said she walked into her barn and she knew something wasn't right with her horse. She went to the barn manager and this person uh, had the sense she didn't grow up around horses. So she went to the barn manager and said, hey, my horse isn't right. I don't know. Could it be colicking? And the barn manager went and said, oh, your horse is fine. Just leave it. She'll be fine in a few hours. Well, the horse owner remembered the course, remembered this information I'm going to tell you today, and said she called her veterinarian. The veterinarian came out and said, oh, yeah, your horse is colicking. Thank you for calling me. If you didn't, your horse probably could have died, and treated her horse, and her horse was fine. So that always stuck with me. And that's why I think this information is so critical to you and anybody that works around horses. The big question is, why do horses get colic? domestic horses, wild horses, we don't see a high incidence of colic. And that's multiple reasons. First, if there's a wild horse that's injured or sick, or say does suffer from colic, they're probably going to get picked off by a predator. So the wild horses in America, you're looking at cougars and bears and other things that might get a really sick, hurt horse, right? That's why we have predators on the planet. In the ancient times, 10,000 years ago or 15,000 years ago, you had other big carnivores chasing horses. So they would get culled out of the herd. But the story of colic in horses goes back millions of years. And again, is one of the reasons I always talk evolution of the horse and always talk history. In every podcast, I always look back and then look forward. So looking back, when we looked at the evolution of the horse from little Eohippus to, Equus, when they were making that transition their digestive systems were evolving for millions of years, instead of meal eating, horses are designed to eat small meals all day or trickles of feed all day in their digestive tract. So as grazers, as large herbivores, they go around and munch forage all day. Small little meals going down into the digestive tract, into their smaller stomachs, which is 10% of their entire digestive tract is just the stomach. It's some of the feed's in there for 20 minutes and it's out in the small intestine. Where like us or large carnivores, we have larger stomachs. We meal feed and then we rest and sleep and digest our food, and then we eat another meal later. Herbivores like horses that are hindgut fermenters, so you're looking at rhinos and tapirs and they're close relatives, where cattle, they're a different story, different topic, different day. But for horses, they're getting this small trickle of feed in their digestive tract. And then that feed goes into the small intestine and then into the hindgut where it sits for a little while. And that's where you get this fermentation of the forage. In cows, all of that is happening in the foregut or in their big stomachs, their rumens. And so cattle will eat a bunch and then sit down and ruminate. Now, to fight off carnivores, cattle have horns. They get in big herds, if you see the wild bison of today, and they'll drive off predators, and so they kind of meal feed for a little bit, eat a lot, and then ruminate. Horses eat small meals all day. Now, when we domesticated them, their digestive systems are the same than they were 5,000, 6,000 years ago. So they're still designed to eat small meals each day, but what we've done is stick them in stalls or paddocks and we meal feed and we throw them hay twice a day and maybe a little bit of supplemental feed. And so they're getting these large meals and that sits in their digestive tract, and that has led to things like colic, laminitis, all these other issues we see. So that is one of the reasons we see it. And you're going to see in the statistics on what causes colic and, why that happens. Because when we do look at their activity budgets today, horses on pasture, when they're out getting those small meals all day, you have a nice green pasture where they can go out or suitable forage, they're doing what they're naturally meant to do. Because if we go back to the research, time budget wise, horses 60 to 70% of the day, they're just munching grass all day. And then the studies where we look at where we stall them and then meal feed them, they're only, it depends on the study, but 30% of the day, 20% of the day they're eating. So what do they do for the rest of the part of the day? That's where you start seeing stable vices and whatnot. But when it comes to the digestive system, when they're used to small boluses of feed going down the esophagus into the stomach, you're getting large boluses of feed. And that's where we start to see things like an impaction colic, which happens because there's so many twists and turns in the small intestine, but also in the hindgut of the horse, that sometimes you get these spots on these turns where feed gets backed up. And impaction colic is one of the major colics we see, where the feed gets stuck and then it just backs up, backs up, backs up, and then stretches the digestive system that it's so incredibly painful for the horse. And that feed has nowhere to go because it's blocked. It can't make it that tight turn. And that's an impaction colic. Sand colic, very similar. You get a bunch of sand accumulation in the gut. It gets to that turn and it just accumulates there. And then all of a sudden you have this big bag of sand, which is the intestines, and feed can't go through. So it is just part of the domestication of horses. And, then there's other things, other factors that can cause colic because it can alter horses' behavior. Things like stress. When a horse is stressed, they may not eat or they may not drink enough. And that could lead to some digestive upset. So all of these factors play a role into, you know, causes of colic. But that's the major reason. We took these horses and we stuck them in pens, or we stuck them in pastures, and pasture horses. We stuck them in paddocks, in stalls. Those are the horses that we tend to see more colic in. Now, leading into the percentage incidence of colic, and there's a really good article. Dr. Freeman out of University of Florida, one of my colleagues, and he wrote an article. He's a very skilled surgeon, 50 years of colic surgery. And it's a very good look at where we are today in the modern world in the 2020s versus, say, how we dealt with colic hundreds of years ago. They were dealing with colic ever since we domesticated horses. And one of the things they used to do in history would be to tie up horses and feed them oil. That's what we use today. It's one of the first things we do. They would feed them olive oil or a type of oil to try to loosen up that gut. So this is something that we've always dealt with. Now, Dr. Freeman, looking at the literature and all the published studies, the amount of horses per year. So out of 100, some studies have cited as low as 4 out of 100 horses, but it's as high as 10, 11 out of 100. And I think that's kind of the safe range. So that gives us, if 11 or 10 out of 100, that's 1 out of 10. And I think some of the discrepancy could also be because horses do such a good job of hiding pain. So we'll talk about recognizing some of the signs. The good news, out of most of these colics, 90% are going to be resolved with non-medical intervention, meaning non-surgical. The veterinarian, you still should always call your vet with colic, always, 100% of the time. But 90% of them can be resolved without a lot of intervention. Up to, depends on the study, 17, 18% of colic will require surgery, but some of the studies, it's as low as 2%. So it depends what you're looking at. And I think, again, that discrepancy is because some of these studies are coming out of veterinary hospitals that are seeing the worst. So they are seeing the worst cases. And so those being admitted to an equine hospital for colic, up to 20% of those probably end up in surgery. And I'll share some of the data here in a minute. Now, I also said colic is the number one killer for the horses under 20. And I just was talking to a horse owner last week who was showing me around her farm, and she was talking about a recent colic case, and she had not had any problems with colic before. It was her first case, and she has roughly a dozen horses on her farm. So she was telling me the story of this mare, and she had to euthanize it. Her mare was suffering. She had the vet come out. She didn't take it to the vet hospital. She didn't have an extra $10,000 to go through a surgery. The vet treated the horse the best they could. And she was very frustrated. She was very frustrated about it. And she's like, I don't understand. I've managed my horses the same for 20 years. And this was the worst case of colic I ever had. So we had a long discussion about that. And it just happens because it is the number one killer for under 20. Over 20, those horses are geriatric. So are classified as geriatric. We know today horses are living into their 30s. But old age usually is what kills them, right? Or they're euthanized because arthritis and just, again, a life worth living. But under 20, still in their prime, colic is by far the number one that kills them. And there was just an interesting study I found, and you'll find this in multiple studies, but here was just one I found in horses in Arabia, in the United Arab Emirates, looking at mortality cases in Arabian horses. And these veterinarians were looking at what caused the death. And it said out of the horses they looked at, 80% of the horses that died under the age of 20 was colic. And the average age was 8 years old in this study. And out of that, most of them were, over 60-70% of them were actually sand colic. As you can imagine, United Arab Emirates, sandy soils, feeding horses on the ground on sandy soils are going to ingest a lot of sand. So we talk about, real quick, if you're in that situation, put down a feeding mat or make sure their feed is not so much up off the ground, but that they're not ingesting sand. Okay. And a lot of times horses will dribble feed out of their grain bucket over into the sand and go and eat that. So you have to be careful and watch your horse's behavior, but you want to make sure they're not eating feed directly on sand, because that will lead to sand colic, which again, I talk about that impaction. So that was interesting. And then when you looked at another, this was out of France, a retrospective study of surgeries in veterinary hospitals. So there was 1,161 cases of surgeries. Okay, so they're looking at mortality rates of surgeries. This can be for anything, any type of surgery in horses. Out of the 1,161 cases, 229 of the surgical cases were for colic, so about 20%. So again, those are all of those. And then the mortality rate, when you look at the surgeries for colic, was about 33%. Meaning during the surgery, the veterinarians made a decision, okay, this horse probably can't be saved. The damage was too much. So it's more ethical to euthanize the horse than it is to try to go through the surgery and hope for recovery. Okay, so now we know this is a serious situation with horses. How do you tell if a horse is suffering from colic? If you've been around horses long enough, or let me just ask you this, how well do horses hide pain? I know I've already kind of mentioned that, but from, a broad view, horses, other herbivores, other prey species, they've learned to hide pain. One of the things I talked about in the mare episode was watching mares go through labor, watching mares go through birth, how quiet they are. Yes, there's some grunting, and yes, yeah, I mean, you can tell she's in pain, but she's stoic and she's quiet. Horses, if they've got little niggles or things that are just bothering them, they've got to hide them, because if not, they'll get picked off. Predator sees that. Ooh, that's easy pickings. So horses do a really good job of hiding discomfort sometimes. And it always gives me such a admiration for our veterinarians who have really well-trained eyes to say, yep, that horse is off, or yep, that's a front left leg lameness. And I'm looking at the horse going, a little bit. I mean, when some lamenesses, you're like, yeah, okay, that horse is definitely lame on that foot or leg. But sometimes they're so subtle, and veterinarians have really trained their eyes well to understand that. So the earlier signs of colic can really be subtle. And then as it progresses, it becomes really obvious. Like I said, I had that mare in a crop circle. She was just in so much pain. A couple articles that we'll link in the show notes on madbarn.com. Under the Learn tab, you can just search colic, but two articles that are really good on impaction colic and sand colic, signs, diagnosis, and treatment and prevention. So check those out. This can help follow up the video. But talking about the signs, I always talk to horse owners. The big thing is, you know your horse's behavior best. You know it better than anybody. So you're going to be able to tell, yeah, buddy, he's not quite right today. Something's off. Or say your horse buddy is always eating all their food, and you go in and there's some food left. That's not right. There's something abnormal. Something is off. That is where you start thinking, okay, what is going on? My horse isn't well. Because again, remember, they can hide a lot of this, but then once it becomes obvious, it's like, wow, it's in your face and you know about it. And I even thought about this as like when we have tummy aches, sometimes we have tummy aches, like, oh, stomach's kind of off, but we just get on with our days. And then we have tummy aches where we're just like, laying on the couch and can't move. And you're like, what did I eat last night? Same thing with horses. So again, anything out of the ordinary should make you go, all right, something's not right. I need to look more into this. Now, again, another great article on madbarn.com, 11 most common causes of colic in horses, plus how to prevent. You can check that article out. A list of common signs. Now, obvious distress, on the ground, rolling, pawing, really laid out, that's not right. Something's wrong. And if there's no obvious like limb, broken leg or something like that, I would immediately think colic. That's the first thing I always think if I see a horse in distress. Then if the vet comes out or it's not colic, and diagnose everything else. But whenever I see a horse in distress like that, I always think colic. Sweaty, flanks, neck, the sides of the horse. That is a sign of stress and a lot of, again, rolling or pawing or activity. The biggest telltale sign of colic is fluffs of hair on the sides of the horse, because they're going to nip at that pain. There's pain in their hind end and they're trying to get at it, and they don't know if it's a bug biting them or what is causing that. So you see it when mares are in labor too, because that's where a lot of pain's coming from. But you'll see these tufts of hair where they're biting at their sides. That is a big one. Pawing again, straining to defecate, refusing to eat. Some of these other things, a dog sitting like a dog, groaning, all of, their lips, they're just not well. It's just obvious. So you can look at that article and see some more of that. But if you see some of the more subtle signs, maybe just little tufts of hair, horse is a little aggravated, the one thing you can always do is check your horse's vital signs. Even if they're colicking, you want to check their vital signs so you can tell your veterinarian over the phone, because they might ask you for that, or they should ask you for that. So it's good to have that information on hand. Now, what are the vital signs? Body temperature. So horses, normal body temperature is about 100 degrees Fahrenheit, 99 to 101. And that's about 38 degrees Celsius. So you want to have a thermometer on hand. Make sure it's if you're using one for in the rectum, make sure it's tied off. You're holding it tight. So you do that. Heart rate, that's a big one. If they have an elevated heart rate, they're obviously under stress. And the normal heart rate for a horse is around 38 beats per minute, so 36 to 40 beats per minute. Um, you know, you can check that. Respiration, which is surprising. Horses only take anywhere from 8 to 15 breaths a minute. They take really deep breaths, and it's a lot slower than you would think. But if a horse is obvious signs of stress. Okay, you can always check hydration, skin pinch test. That skin should bounce right back. I'm hydrated, my skin's bouncing right back. Horses should do that too. Mucous membranes, you can take your thumb right in their gums, just really quick. You can just do that. You'll see a white splotch. It should become pink right away. Then you can also listen for gut sounds. So this is why you'd want to have a stethoscope, not just for heart rate, but also gut sounds. You can listen with the stethoscope, and if you don't hear any gurgling, which you normally would, that could be signs that there's a blockage in there or there's some sort of colic. I would also advise you to do this when your horse isn't stressed. Go do it today or tomorrow or the next time you see your horse. Just try to take their vital signs. Get your horse used to you doing that. And then when there are some times of stress or when you're stressed, you've done it. You're trained, the horse is trained. It's one of the things working with horses, when you do things, you want to make sure they're habituated to it. It's like when I always talk about emergency management. I've got a fire beating down, coming down the mountain towards my facility, and my horse has never been trained to get into a trailer, and I'm trying to get him into a trailer. I'm freaking out. The horse can smell the fire. They're freaking out. I'll tell you what, you're never getting that horse in that trailer. You're not. When a horse doesn't want to get in the trailer, they don't want to. So you want to train them, right? Train them for emergencies. And this is one of the instances where you want them used to you checking their vital signs, and you want to be able to do it so you can do it, and it's second nature to you. Just some bits of advice. Now, if you suspect colic, the most important thing I can tell you right now, period, end of story, end of video, really, is call your veterinarian. Always, always, always call your vet. When in doubt, call your veterinarian. That's why you have them. That's why they do what they do. I've worked with many veterinarians, trained many veterinarians, taught many students that became veterinarians. I was going down the vet path. That is what they do. They expect those phone calls. You're not bothering them. Your horse's life is in danger. Call them. Okay. Now, what do you do if you come across your horse and you suspect colic? Again, don't panic. That's the first thing. Second, especially if you're stalled or in a paddock, remove all hay and feed. You don't want them to keep eating, right? If there's an impaction or something, you don't want to make the situation worse. If you can, walk your horse. Prevents them from harming themselves because, again, they're in pain, so they may want to roll on the ground a lot. They can get hurt or cut that way. Exercise does help mobilize, get the body going and could help the digestive system a little bit, blood flow, things like that. But if your horse is uncooperative, don't force them. Again, always think of your safety first. I know I've been in many emergency situations with horses, and you want to jump in without thinking of, can I get kicked? Can I get hurt? Could that horse fall on me into a wall? Be very careful. Your safety is always paramount, but if you can get your horse walking, do that. I would always say don't administer any sort of pain medication unless your veterinarian tells you. The reason is, I know you want to alleviate that pain. We can give them some Banamine, but that can mask symptoms that the veterinarian would observe. So if you gave them a bunch of pain medication, and the vet comes and the horse isn't as distressed, they may not think it's as severe as it is. And so only give the horse anything if your veterinarian tells you to. Okay. Always, always follow their advice. That's why they're there. Now, as I said, 90 something percent of those can be treated on farm. The horse will recover fine. Those 10%, maybe a little bit more than that, horses that need to go to a veterinary clinic or hospital for surgery. Very good study done looking at the risk factors of colic in horses. And there's multiple studies out there looking at this because it is such a big issue around the world. The number one cause of colic in horses is changes in hay. So when they looked at thousands of data points in this study done out of Texas A&M back in the day when I was there, this was published, and come to find out, it's really like I said from the very beginning. It's dietary management, it's nutrition. Yes, there's other causes, and I'll talk about that here in a second. But it all boils down to how we feed them and feeding management and dietary changes. So in this study, recent changes in hay was the number one cause of horses suffering from colic. So going from, it could be not so much bales of hay, but say you were feeding alfalfa and all of a sudden you've got to feed a grass hay. I mean, that is a massive change to a horse. It could be different cuttings of hay. You get a new shipment in and you notice the quality's different. Other things like we never feed moldy hay ever, ever, ever to a horse, or hay with a lot of debris in it, because again, that can lead to colic. So that was a big one. The second biggest cause was recent diet changes. So maybe not so much hay, but maybe you were feeding a concentrate and you ran out of the bag and oops, and you went to the store and they didn't have it. So you found a different one and you went and fed them the same amount, that feed of a different feed. That is a sudden dietary change to the horse's digestive system, which can upset the balance. So that was number two. Then if they had a history of previous colic, they had a higher propensity to have colic again. So that was a big one. And if weather changes, that's one too that owners talk quite a bit about. That's stress. That's one day it's hot, the next day a huge storm comes in and it's hailing and tornado warnings and sirens are going off and there's just the horses are stressed. So that could lead to some signs of colic. And then there's just other things that happen, like they develop growths, lipomas, things in their digestive tract. But dietary management's the big one. And so this is where I know I can make a difference. You can make a difference, especially if you share this information with other people. Anytime you change a horse's diet, you do it slowly. I see recommendations from anywhere from 2 weeks. I go 4 weeks. It's just easy to remember if you can do it. Now, sometimes you can't. It's I've seen it. I've seen it with, especially in times of drought and people are having difficulty getting hay and they run low on hay. So you got to be forward thinking sometimes with dietary changes in horses. Um, emergency management. If I've got, like I said earlier, a fire bearing down on my property and I got to jump in a trailer with a horse, I don't have time to grab feed. I'm out of there. My horse's life's in danger. My life's in danger. We're getting out of there. So sometimes you can't do this, and I understand that. But if you can forward look and say, okay, I'm making dietary changes, do it slowly. I say 4 weeks because it's easy to remember. Week one, 75% of the old feed, 25% of the new feed. If it's hay, I mix it. Old hay, new hay every day. So 25%. Week two, 50-50. So 50% of the old, 50% of the new. Week three, 75% of the new feed, 25% of the old feed. By week four, boom, they're transitioned. So you do it over a 3-week period, but by week four, you're done. If you're feeding new concentrate or a different supplement or something like that, you can introduce it slowly over a few days or a few weeks. But if you have bags of feed, 75% old, 25% new, mix it up, 50-50, and then 75 new, 25% old. So that's probably an easy way to remember, because that dietary change is the one that will really impact your horse the most. So you want to do it slowly. Please remember that. Please, please, please. Some other contributing factors. Okay. Horses that are stalled will more often than not suffer colic than, say, horses out on pasture. Makes sense. Horses are meant to graze all day. Their digestive systems are still designed that way. So they're out grazing all day. They're not going to probably suffer or a lower incidence of colic. They will. That mare I walked across, she was out on pasture and she had colic, right? But stalled horses need that turnout time. So it's very critical that they get that exercise every day, that they are turned out. Sand. I talked about sand. Feed on a, something either up off the ground, just off the ground, or you have mats that they can eat off of. Even hay, you throw hay out. I've done it. I did it years ago. Tossing hay to horses over the fence, pile of dirt, especially Florida, sand accumulation. That's where they're going to get sand in their gut. So that's a common cause of colic. Dehydration. So if you can imagine, horses need to produce a lot of saliva to eat hay, right? And if you're eating this drier hay, which is good quality, great nutrients, and they're not producing enough saliva or they're a little bit dehydrated, you're not going to help lubricate the digestive tract. It's not going to moisten up. And then again, you can get the blockage. Never feed moldy hay or feed, ever, ever, ever. Dental problems. Again, mastication, chewing up that hay. If they can't chew it properly, break it down, longer stem forage gets stuck, can get stuck in those twists and turns in the digestive tract. And then even long-term use of NSAIDs, those non-steroidal anti-inflammatories. We don't want to long-term, it increases the incidence of colic. So those are some of the things that can lead or predispose horses to colic. And there's a long list. Again, those articles you can read on madbarn.com, but we always go back. The data shows most of these horses, or a lot of these horses that suffer colic, it's because of dietary changes. It's something in their diet, right? Or we're feeding them just those 2 meals a day, shift in weather, they get digestive upset, boom, they have a colic. So again, that's why we want to feed them optimally 3, 4, 5 times a day. And we'll cover that in a future podcast, talking about dietary management and how that shifted so much over the years. Now, I'd like to tell you another story leading into surgeries. Like I just said, I was, when I was younger in my career, I was going to be an equine vet. That was my career path. And when I went to graduate school and I kind of decided I love the research side, I love teaching, I have a passion for it. And, I thought, well, I can probably maybe make a little bit more money, whatever. And I decided to go the academic route and get a PhD and do research and teaching. But in my undergraduate days, any of you that are veterinarians or know veterinarians know it takes hundreds, if not a couple thousand hours of experience working with veterinarians to even think about applying to vet school. It is, in the United States, it is very, very competitive. So I was riding around with my veterinarian in San Diego, and she was amazing. She'd pick me up, or I'd actually drive to her house, jump in her work truck. She had the large equine vet truck with the back and all the drawers and everything. And we would drive around San Diego seeing her clients. And one day she said, I have a real treat for you, Chris. We're going to go do a couple colic surgeries today. And it was a long day. It was pretty amazing. Went to the equine hospital, one of them in San Diego, in California, and came in, and the horse was already uh, prepped for surgery, and she was going to assist with the anesthesia for the day. And I was able to help her prep and observe as these two surgeons worked a long time on these two horses that had colic, and they were going through surgeries. What I can remember is, again, the viscera, all the intestines of the horses out on a big tray as they worked on the horse to clear the impaction colic that they had, and them rinsing and everything was sterile. But then how they put all of that back in the horse. And I remember watching them like just, armpit deep in these two horses, and then stitch the horse up and staple them shut. And then the horse coming out of anesthesia. It just really stuck with me about how skilled these surgeons were. Looking at the data, it depends on what study you're looking at. The one I've always gone to is this study out of Western Canada. It was the a vet hospital at the university there, and they were seeing probably some of the worst cases of colic. By the time they get to a vet school level, my experience at the University of Florida Vet School, the Texas A&M Vet School, even walking around Auburn and some of these other major universities, their veterinary schools, they tend to get the worst cases, whereas say a local vet hospital might get less severe cases. But so I always keep that in mind when I look at these statistics. Of the colic cases that were sent to the Western College of Veterinary Medicine in Canada, 93% of the non-surgical medical cases that they saw survived a discharge. Of the surgical cases, and this was a 10-year study, so they had 277 cases, 90 or only 33% survived to discharge. So thinking about why, I think some of it was there was a poor prognosis once they were doing the surgery, or the surgical cases were, we can't afford it, it's going to cost too much down the road. When you look at the studies, I've seen 60, 70, 80% of horses survive colic surgery. And so there is some good outcomes out there. And that study that I talked about in Canada was 20 years old. So looking at studies that are more recent, so veterinary medicine has gotten a little bit more advanced. Looking at that data, types of colic that they see at these veterinary hospitals, because that's where we get a lot of our information. The number one type of colic that you'll see in study after study is impaction. Again, talked about these twists and turns in the gut of the horse. It just gets to the point where, they there's nowhere to go. So a lot of depends on the hospital. So the data I'm looking at here in front of me, Cornell University, 25% of their horses at the hospital were impaction colic. The University of Guelph in Canada, 21%. Ohio State, 21%. And Penn, hospital there in the United States, 23% of the horses that they saw for colic were impaction type. So almost 1 out of 4 of the colics were impaction. The next most common type seen is these large intestinal strangulation obstructions. So sometimes you have either twists or turns, or there is like what we call lipoma, a growth in there that will strangle part of the digestive tract of the horse. And so then the feed can't go anywhere. Now, keep this in mind. These are the vet hospitals reporting this. On farm, your veterinarian, it's probably an impaction or an impediment. They give them some oil, they give them some medication, they're able to clear that, and they're back to normal. Okay, these are at the vet hospital. Wow, this is a very, very tough case. The third most common type was small intestinal strangulation. So a lot of the colics we see is the hindgut. So that's the cecum, the large colon, that part of the digestive tract. Small intestine, you do see some of this with there. And then some of the others is a large intestinal non-strangulation obstruction. So there's some obstruction there. You get things like spasmodic colic, where it's just spasming. So that's very, very painful. Again, that study out of Canada that I just talked about, large colon impaction was the number one they saw. Large colon displacement. So 16% of the cases, that's where the colon displaces itself, rolls over on itself. That's a very difficult colic. So it kind of, twists where the feed can't get through. So that can happen. Okay, I want to wrap all this up. The big question is, my horse had colic, now what? It's resolved itself on farm, or I had surgery. How do I take care of my horse? What do I do? Always work with your veterinarian. Always, always, always. Then go through your management. What caused that colic? What could have led to my horse colicking? Was it my dietary management? Was I feeding them some bad hay? Were the, like I talked about in welfare, accidentally a horse flipping over an automatic waterer and had no water all day? Were they dehydrated? How could I prevent that from happening again? Don't beat yourself up, but evaluate what you're doing and say, okay, is there anything I can change and alter to, not have my horses be predisposed to colic? Like, feeding twice a day is really not ideal. We want them to eat hay all day long. So there's different strategies and different feeding management that's matured in the last 10 years, I would say, and how we feed horses in the last 20 years. But again, talk to your veterinarian. But if you're doing a non-surgical recovery, when do you feed them again? Or when do you let them eat? Normally within 12 to 24 hours after it resolves itself, you can let your horse, go back to eating. Always check their dental health. But if they are stalled, you want to make sure they're out as much as possible, like up to 12 hours if you can, especially after suffering colic. You want them stretching their legs, getting exercise, getting blood flow, get that gut going again and functioning normally. If you make any dietary changes, again, do it slowly, because it could have gotten you into that situation before, but you want to give their digestive tract time to adjust. Those microbes need to change in the gut. Again, that's another podcast for another day, but you need to allow their digestive system time to recover. The hard one is surgery. How do you recover from a big gut surgery? This is where you have to be careful, and this is where you want to work closely with them and talk to them. Horses, the data shows on average, if a horse has a colic surgery, they stay in the hospital for about 6 days. In the studies, the range was anywhere from a very few days, 2 to 3, up to 75 days. That's a long hospital stay. If they're under food restrictions, especially after surgery, they could enter starvation period, which you have to be very careful refeeding a horse. Dr. Carolyn Stoll at UC Davis has a great article on that, on refeeding starved horses. If you're changing that diet, again, from what they're eating in the hospital to what you're feeding at home, make sure you transition. So you want to, when that horse gets home, you want them eating the diet they were eating at the hospital. So make sure you talk to them about what hay, what else they were feeding. Okay, so you want to make sure there's no massive dietary changes. And again, that's going to depend on where you live in the world and what hospital you're working with. Now, one of the things is, especially with surgery, is you have this population of microbes in the hindgut that are critical to nutrition and digestion. They're very sensitive to rapid and sudden changes. So this is where we run into some problems, like especially lemonitis and stuff. If a horse has been off feed for 24 hours, that population's already starting to shift. So some of the things you can do is slowly refeed them. You can put them on a pre and probiotic to help reestablish those beneficial organisms. One thing after surgery is feeding them handfuls of hay. You don't want to give them big loads of hay, but little bits of feed and start that trickle back down into their digestive tract. And you really want to be careful. You don't want to shock the microbes. If this horse has been on pasture and you're after surgery and you're reintroducing them to pasture, they've gone from a hospital stay, probably eating hay, to, could be lush or green. You don't want to shock the system. So introduce them very slowly. So it's almost like how we introduce horses off winter hay to spring pasture. Let them out on the pasture for like 15 minutes each day for the first few days, and then increase that every 15 minutes every day up until day 16 to where they're grazing for 3.5 hours. Then after day 16, you can just let them turn out full. So just to repeat that, 15 minutes day 1, 30 minutes day 2, so on and so forth. The great news about all this, to wrap it all up, is 90% of colic cases tend to resolve on farm, non-surgical, vet call, well worth it, get your horse back, and they leave healthy and happy lives. But if we look at statistics, 10 out of 100 horses roughly will suffer colic every year. Out of these 10, one won't survive. So roughly 1 out of 100 horses every year dies from colic under the age of 20. So it is serious, and that's why we want to talk about it. Recognize the signs, know what to do, and get them treated early, and then know how to prevent it. Again, proper dietary management is one of the best things you can do for your horse to keep them healthy and happy. So take that information, spread the word, talk to your friends if they don't know, anybody that's had to deal with colic. Again, don't beat yourselves up. You do the best you can. And, if you made it this far, thank you. It shows you really care. And just before you go, if you don't mind subscribing to the YouTube channel, we're going to keep these video podcasts going. You obviously have the audio podcast version of this with a colic that you can also listen to. Be sure to check us out on TikTok, obviously YouTube here, Instagram. Go to madbarn.com, look under that Learn tab, type in colic. There's a ton of articles and resources for free. All of this is free. And all we ask is that you share and you follow, like and subscribe and all that fun stuff with YouTube. So thanks for staying and thanks for caring, and stay tuned. We'll have more coming your way soon.